who have logged on to YouTube for this program, where I'm going to share about measures to take care of your eye and your eyesight. I'd also like to thank Santon, which is a pharmaceutical company which has partnered with our hospital. They have been doing wonderful work to create public awareness about eye and eyesight. Uh, this week, on October 8th, was the World Sight Day, where we celebrate this day to mainly make people aware about treatable or curable blindness. And this is going to be my main crux, where I'm going to talk about the curable blindness, how to take care of your eyes and make sure you have very good eyesight throughout your life. So, the eye is the jewel of the body. You know why it is called the jewel of the body? This is the most important sense organ, according to me, because a person can live without having a good hearing, or without an arm or a leg, but it is very tough to lead a life without eyesight. Eye is a very important structure of the body. The memories which we have about our loved ones, our dear ones, our friends, are all created when we see when we see something, and this is registered in our brain as memories. So the eyesight is the window to the body. Around 1.3 million people in the world have eye problems. Most of them are curable blindness. And there are a lot of diseases like diabetes, hypertension, kidney disease, and a few types of cancers, which can also be detected by eye examination. So, as I was talking about curable blindness, there are various diseases of the eye which, if treated on time, can reduce or treat blindness altogether. So, as you can see these photographs, there are the first one on the left hand side is about cataract, where you can see that there is a brownish thing inside the eye. Now, this is cataract. The other one is corneal opacity. There are few children who are born with cataracts in their eye, and if this treated on time, can reduce their chance of going blind and make sure that they have very good eyesight throughout their life. The fourth picture, you can see a gentleman wearing thick glasses. Now these patients have a very high refractive error or a very high glass power, which can again be treated, and and he can lead a normal life. There's one more picture of the retina where you can see that there is blood collection. Now this is either due to diabetes or hypertension, and if this is not treated on time, the patient can go blind. There's one more gentleman you can see that who has had injury to the eye, and if the injury is treated on time, we can restore vision in this particular gentleman. So this is basically known as curable blindness. The common eye problems which we generally see in our outpatient department are patients coming with refractive errors. Refractive error meaning short-sightedness, long-sightedness, and presbyopia. I'll be discussing this in detail very soon. And this can be treated either by glasses, contact lenses, or by LASIK laser surgery, which is preferably done below the age of 50. People who are above the age of 50 can wear glasses. Who do not want to wear glasses can undergo a multifocal lens implantation. Multifocal lens basically means the lens focuses for distance, for intermediate as well as for near. It is just like a progressive glasses which a lot of us are wearing after the age of 40, and hence once they get this multifocal lens implanted inside their eye, they need not wear glasses. So treatment is totally customizable. This is a common sight at most of our houses. Now, children are attending their schools through phones. So, online classes have become a norm, thanks to the COVID era, which is still going on. But excess of use of these gadgets can be harmful for the eyes. So, if the child uses the phone for a longer time, apart from school, if they play a lot of games, this causes a lot of eye strain, and they can develop power also. So my recommendation is make sure, see, online classes is a necessary evil, because school also have to finish their curriculum. So we cannot blame the schools also, but it should be restricted to maybe 4 or 5 hours, and it should not be more than that. And the children should actually, since we cannot go out much now, they should actually play on the terrace and make sure that they don't use too much of gadgets. Otherwise, they'll land up wearing glasses. This is the same thing with adults also. Most of us do our office work now from home by the use of computers or laptops. or we, for recreational purposes, we use a lot of tablets or phone also. So this causes a lot of digital eye strain, which is characterized by dry eyes. Dry eye is a very common problem because of excess of use of gadgets, which we see nowadays. Dry eye can be characterized by stinging or burning sensation in the patient's eye. There can be excessive tearing or watering from the eye. There can be a sandy or gritty or a foreign body sensation in the eye. And there can be episodes of blurred vision, which usually recovers after we blink our eyes. This is a very common thing. And very few people can have some kind of irritation or redness in their eyes also, which are typical symptoms of dry eyes. Dry eyes are usually conventionally treated by lubricating drops, which works in most of the patients. And the best thing, as I tell you, is prevention is better than cure. So make sure that you use your gadgets to the minimum extent. So use it for your work. Don't overuse it. Don't use it too much for your recreational activities. And necessity is the mother of all inventions. So in patients who have advanced dry eye, we have something called the LipiFlow treatment at our hospital. Basically, this is pulsed vector thermal pulse therapy, which is the hi-fi term which I'm using. But for commonly saying, this is basically a treatment which generates some kind of heat and massage to the eyelids. So once this is done, the patient's dry eye symptoms reduces to a great extent. We have had great results after we got this machine, and we are able to treat dry eye successfully with this technology. So this is the latest for the treatment of dry eye. If the dry eyes cannot be, if the patient does not have relief by the conventional treatment, which are drops, you can opt for this LipiFlow treatment, which is available at our hospital. Now, I want to talk about little bit about refractive errors or patients who are wearing glasses. Refractive errors basically are of two types. One is long-sightedness, where the patient is able to see for distance, but he's not able to see for near. This is also known as hypermetropia, and it can be treated by wearing plus glasses. Then there is something called short-sightedness, where the patient is able to see very well for near, but he's not able to see for far. So this is also known as myopia, and this can be treated by giving minus power glasses. Patients who don't want to wear glasses can undergo LASIK eye surgery. The treatment which we do at our hospital is called Contura LASIK. Now, Contura LASIK is the latest when we talk about LASIK eye surgery, the latest technology when we talk about LASIK eye surgery. In LASIK eye surgery, it is a very simple daycare procedure where it takes around 15 to 20 minutes for the treatment of each eye. We actually create a flap. You can see that in the number 2 picture, we have actually created a flap, a thin flap. And then in the number 3 picture, you can see that there is the green light, which is the laser light, which is passed on the eye. So basically, with the LASIK laser, what we do is we actually, reshape the cornea with the laser. It's a cold state laser, so it does not generate any heat inside the eye. It is a very, very safe procedure. And after we've passed the laser, we put the flap back, and that is the end of the procedure. Now, there are two ways of creating this flap. One is called the conventional contour LASIK, where a small blade is used to make this flap. That is also safer, but there were a few drawbacks with this technology, and hence the advent of femtosecond laser or bladeless laser has come into picture. So we use a laser itself to make the flap. This makes the procedure much more safer, and the patient's visual acuity or the vision after surgery is also much, much better. So usually laser surgery is done in patients who are above the age of 18, provided their refraction or their power is stable. This is one of the most important criteria. The power has to be stable. If the power is fluctuating, the doctor will never recommend of the patient to undergo refractive surgery or LASIK laser surgery. So power becoming stable and the age are two most important criteria for a patient to undergo LASIK. Next, I'm going to talk about cataract. Cataract surgery is one of the most commonly performed or the highest performed surgery in the world. Cataract is basically a natural aging process. Like our hair becomes white with age, similarly, a natural lens which God has given inside our eye becomes yellow, brown, or white in color. And this obscures our vision or blurs our vision. Any blurring of vision after the age of 50 has to be evaluated for cataract. So any patient above the age of 50, if he has blurred vision, has to be undergo an evaluation for cataract. Cataract can be treated by a simple daycare surgery. and the patient need not stay in the hospital. He can come in the morning, get the surgery done, and can go home maybe in 6 to 8 hours, and he can actually get back to work in maybe 2 or 3 days, provided everything goes on well during the surgery. So there are two ways of getting cataract surgery done. One is the conventional technique, which is also known as phacoemulsification. In phacoemulsification, what we do is we use ultrasound energy inside the eye. So in simple terms, I usually compare it with two things: either beating up the egg or making chutney in your mixie. Similarly, we use ultrasound energy to beat up or emulsify the cataract. So the cataract is emulsified into a liquid and is absorbed or sucked out of the eye. So we need not make a large incision or a large opening. It's a very small 2 millimeter opening, and this heals or seals within 1 or 2 days, so that the patient can get back to work in 1 or 2 days. Now there is a much more advanced technology which is available with us, and this is called the femtosecond cataract or the bladeless cataract surgery, commonly known as robotic surgery. Now, what is the advantage of this robotic surgery? Now, this is the best way of removing the cataract from the eye. Now, I'll tell you why this is the best way. Because if we use this machine, we need not make any opening or incisions in the eye. The cataract is cut into small pieces by the machine itself. So it is like a robotic surgery, which is very, very precise. And hence, it makes the surgery much more safer. The patient can get the surgery done as a daycare procedure, and following the surgery, we implant a intraocular lens inside the eye. The natural lens which God has given is removed, and it has to be replaced with an artificial lens, which is known as intraocular lens. And the best way of getting cataract surgery done is using the femtosecond or the robotic surgery, which has made it much more safer for the patient, and the vision is also much more clearer after the surgery. Next, I'm going to talk about glaucoma. Glaucoma basically means raised pressure inside the eye. Like we all know about blood pressure in our body. So whenever there is a raised pressure inside our body, this is known as high blood pressure. Similarly, if the pressure inside our eye is more, this is known as glaucoma. 60 million people worldwide suffer from glaucoma. This is the second most common cause of blindness in the world, because the vision which we lose because of glaucoma can never come back. So we have to be very, very cautious about this particular disease. And there are 7.5 million people who go blind because of glaucoma, and we have to be very, very careful about it. Patients whose parents have glaucoma have to get themselves evaluated every year to make sure that they don't have glaucoma. Because if this disease is detected early, we can give treatment and the patient need not have any loss of vision. If it is treated on time, the patient can preserve vision throughout his life. So this is a picture of a normal optic nerve. See, basically glaucoma affects the optic nerve. It is the disease of the optic nerve. So this is a normal. On the left hand side, you can see that this is the normal optic nerve. And on the right hand side, you can see that this is the glaucomatous optic nerve. You can see that the nerve is already become very pale or white in color. Now what happens is, whenever the pressure builds up inside the eye, this causes some kind of pressure on the optic nerve, and as this compresses the optic nerve, and this causes this kind of a picture where the patient loses his vision. So a normal patient will have good side vision or field of vision, but if he develops glaucoma, his side vision becomes slowly reduced, and in advanced cases he has something like tubular vision. So he can only see things which are in front of him, and he won't be able to appreciate things around or by the side of his visual field. So you can see that patients who have advanced glaucoma, when they walk, they generally hit objects which are on their side, or like a table or chappals which are left on the ground. And they don't realize, because they are not able to see, their visual field or the extent of their vision becomes reduced only to central vision. So this can be avoided if glaucoma is detected in the early stage, and they can preserve vision throughout their life. Glaucoma is usually treated by drops. So 80% of the treatment patients who have glaucoma, they can just apply drops and can preserve their vision throughout their life. Sometimes the drops don't work, And in such situations, we use something called a selective laser trabeculoplasty, where a laser is used to reduce the intraocular pressure. Sometimes even the laser doesn't work, and we have to do something called glaucoma filtration surgery, where we create a small path inside the eye itself to drain the fluid from inside the eye. So glaucoma, basically what happens is there are two theories. One, the fluid production inside the eye is more, and this leads to raised pressure inside the eye, or the pathway for the fluid to go outside the eye becomes narrow or closed, and again this causes raised pressure inside the eye. So a simple surgery can make sure that we create another artificial pathway for the fluid to come outside the eye and reduce the pressure inside the eye. But with the modern day medicines, I see that 80 to 85% of my patients are applying the drops, and they have controlled their pressure inside the eye, and glaucoma is well treated with medication, with drops itself. Next, I'm going to talk about diabetes. Diabetes is a very bad disease for a patient to get. Around 26 million patients in India, 26 million people in India have diabetes, and it is expected that around 80 million people are going to be affected by the year 2025. It is more common in patients who live in the cities. 30% of the urban population has diabetes, whereas only 5% of patients who live in rural areas or villages have diabetes. The cause is obvious, that in the people in cities like us have a very sedentary lifestyle. We don't exercise, we eat a lot of food from outside, and this kind of lifestyle is not good, and hence there is an increase in patients who have diabetes. 20% of the diabetic population develop something called retinopathy, which affects the retina of the eye. And there is a 25% higher risk of patients who have diabetes going blind than the general population. I'm not trying to scare you here with all these slides. I'm just trying to make sure that you're aware of all this and you take care of your health and your eyes and get timely treatment. That is the whole purpose of this talk. So this is a picture of a normal retina. You can see that the blood vessels are all healthy, but a patient who has diabetes, the retina looks like this. You can see these white spots, and there are these blood clots. So these white spots are basically accumulation of fluid which happens in retina, and these blood clots are basically leakage from the blood vessels which happens in the retina. And if this is treated on time, we can save the vision. If it is not treated on time, you can see that in the other pictures you have this blood collection, which is basically known as vitreous hemorrhage. Then if it goes to that stage, then we have to do a surgery called vitrectomy to remove the blood, and then the visual outcome is not that great. So in the first two pictures you can see that there is only whitish fluid collection in the eye with blood vessels, and this can be treated by something called green laser or pan retinal photocoagulation. So this is a laser which is done to the retina, which makes sure that these white spots and the blood clots disappear. This can be done in the early stage of the disease, and we can prevent visual loss. So my recommendation to all the people who are watching this program is, if you have diabetes or hypertension, make sure you get your eyes checked every year, and make sure your doctor tells you if there is any problem. Make sure you get early treatment, because this pan-retinal photocoagulation is a very simple treatment, which if done on time can save our vision. Now the next thing which I'm going to talk about is corneal opacity, or whitening of the cornea. As you can see here, few children or people are born with this, and few develop corneal opacity because of corneal infections, like you can see in the second picture. And this can be treated by corneal transplant. Corneal transplant is a surgery where a donor, a person who dies, donates his eye, and this is kept on the patient who has a corneal opacity and sutured like this. Now, once you do this, the cornea becomes clear and the patient gets back good vision. So this is a social responsibility which all of us should follow. So once there is anybody who dies in your family or something, please inform the eye bank on time. So the ideal time to remove the eye is between 6 hours to 24 hours. If it crosses 24 hours, the cells inside the eye also die, and it is not viable for use. So the ideal time is 6 hours, but it can be removed or it can be donated within 24 hours. So if you want to continue living even after your death, make sure you donate your eyes, because you can give eyesight to a person who needs it. And if you donate one eye, there is a possibility that you can give vision to around three people, because the cornea itself has different layers, and it can be transplanted layer wise. So a person who requires one particular layer can get that particular layer transplanted, and the other part can be used for the second patient also. So each eye, if you donate, can sometimes give vision to three people. Always remember that, and make sure that you donate eyes after your death. The other thing which we commonly see in our outpatient department is patient complaining of foreign body or something going inside the eye. If something goes inside the eye, the first thing you should do is please wash your eye with clean drinking water, and don't use tap water, because it can cause infection. Do not rub your eyes. And if you still feel that after washing also there is irritation in your eye, make sure you contact your eye specialist, because you can see in the first picture there is a small rust particle. And if this is not removed on time, it can cause infection, like you can see in the second picture. And once it goes to that infection stage, it becomes very, very tough to treat, because then the treatment goes on for almost 3 to 4 weeks for it to become normal. So make sure, if there is any irritation after you wash, if you still feel that there is something in your eye, please go and consult an eye specialist, and don't take it lightly. The other common thing which we see in our day-to-day practice is chemical injury. A lot of us use acid or alkali like bleach to clean our bathrooms, but this is not the ideal way of cleaning the bathrooms. So because if these things get by mistake splashes and falls inside your eye, it can cause corneal burns. Like you can see in this picture, the cornea, the stained area, the green area is the area which is burned because of the chemical. If something like this happens, first thing is to make sure you wash your eyes with clean water, drinking water, as first aid. So this reduces the chemical which is present in the eye. And second thing is, it is an emergency, please visit an eye specialist and make sure you get your eyes treated on time, so that it does not cause further injury or reduces the vision. If it is treated on time, the patient can get back good vision. That is the importance of timely treatment. So to end my talk, I would just like to give you some high care tips for good eye care. So make sure you take a good vitamin A rich diet. For vegetarians, vitamin A is richly available in all green leafy vegetables, in carrots, in papayas. So these are very good or rich source of vitamin A. And patients who take non-vegetarian, they can opt for taking fish in their diet. Regular annual checkup of eyes is with an ophthalmologist is very mandatory, especially after the age of 40, because most of the diseases in the eye, or diseases which affect the eye like diabetes or hypertension, usually happen after the age of 40. Now, children of parents with eye problems should get their eyes checked in their early age. In fact, I recommend that every child who's going to join school at the age of 6, he should get the child's eye checkup done. It should be mandatory, because there are few children who will not tell you that they are not able to see clearly. And once they join school, especially in first standard or second standard, they have to see boards. And if their eyesight is not good, they are not going to see the board clearly, and this is going to affect the performance of or their studies in school. So make sure that every child before joining school should get an eye checkup done. And every parent who is wearing glasses, if one parent is wearing glasses, there is a 25% chance that their child can have glasses. And if both the parents wear glasses, there is a 50% chance that their child might have glasses. So patients or parents who are wearing glasses, make sure that you get your child's eye checkup done, and to make sure that they rule out that make sure that get an eye checkup done. And if glasses are required, make sure that they wear it at their early childhood itself. A good control of diabetes and hypertension is very essential, and patients who have diabetes or hypertension should get their eyes checked every year. This is very, very important, because if diabetic retinopathy or hypertensive retinopathy is detected on time, we can avoid further damage to the retina, and early treatment can preserve the vision. Patients with family history of glaucoma or retinal detachment should also get their eyes checked up regularly. Thank you. I hope whatever I said was useful for you and you will take care of your eyes well. And one more important thing is make sure as a social responsibility, please pledge your eye. And if there is any untoward incident in your family, don't hesitate to donate your eyes, because your eye donation can give vision, not one, three people. Thank you. Yeah. Manigandan?
Yeah, yes,
Mr.
sir.
Ram? Yeah, so that brings me to the end of the talk. Let this session be interactive. So anybody has any questions, you can ask. There is a chat box on your YouTube. You can just type your question there, and I will answer your queries. So are there any questions?
Yeah, yes, sir. Mr. Rahul will
Yeah,
communicate to you, sir. Mr. Rahul?
Yes, sir. Thank you so much, sir.
yeah.
Thank you so much.
So I'm ready to take questions now.
Yeah. Uh, yes, sir. You can take the question, sir.
Yeah, I think there is one question by one Mrs. Madhu. Her question is, if my child does not have stable vision till 18 years, then can LASIK be done? No. Mrs. Madhu, the first and most important criteria is that that the refraction or the power should be stable. Now, if the power is not stable, the problem is I will treat your child at this particular age. Maybe say if he has a power of 4, I will treat that 4 diopter power. But if his power is not stable and it is still in the increasing phase, maybe he will get back power after 6 months. So that is not the ideal thing. See, a person is undergoing a surgery, so we should make sure that the surgery lasts him throughout his life. Okay, so if the power is stable, then the chance of the child or the person getting back power is very less. If the power is not stable, then there is a high chance that he might get back power. So that is one of the most important criteria. So if the power is not stable, I generally don't recommend LASIK surgery. I think there is one more question by one Mr. Ramesh. He wants to know, he's been having diabetes for past 5 years and he's never got his eye checked. So what is my recommendation? Okay, now, Mr. Ramesh, I would like to suggest that once you are detected with diabetes, it is the duty of the diabetologist to tell you. Definitely, they will tell you that you should go for an annual eye checkup. And as a patient, it is your duty to get your eyes checked once a year. This is very, very important, because there are a lot of things which we can detect. Like, if you have retinopathy and if it is detected early at your during the disease, we can treat it with the green laser and we can restore your vision. Second thing is, even by examining the eye or examining your retina, we can tell you that you might have renal pathology. Basically, your kidneys can also get affected by diabetes, so this can also be detected in the eye itself. And if we tell you that your kidneys are also affected, you can get treatment for that also, and it can prevent advanced disease of the kidney also. So that is one more thing which can be detected with eye checkup. Okay, there is one more question by Mr. Sohan Lal. Now, Mr. Sohanlal wants to know what are the lens option or the intraocular lens option which you would recommend for cataract surgery. This is a very, very good question. See, now cataract surgery has become a customizable surgery. So there are a lot of patients who want only distance vision. They want to see only for distance and they don't mind wearing glasses for near. Now, these patients can opt for a monofocal lens. A monofocal lens is something which focuses for distance, and you'll have to wear glasses for near. But I recommend a multifocal lens for all my patients. Just imagine, at the age of 60, if you have an option of not wearing glasses, and if you're able to see well for distance, for your computer use, or even for sewing a needle, if you're able to see clearly, then I would definitely choose that lens. So a multifocal or a trifocal lens gives us that freedom. We can actually get rid of our glasses after cataract surgery, and you need not wear glasses if you implant a multifocal or trifocal lenses. But very rarely the patient might have something called astigmatism. So this can be detected only after we do a scan of the eye, or we measure what lens power has to be implanted for that particular patient. It is called ultrasound or a scan, by which we detect what particular power has to be implanted for that particular patient. So sometimes we detect something called astigmatism or cylindrical power. If the patient has cylindrical power, he will have to be implanted with a toric lens or a toric multifocal lens. So depending upon that, if you implant a toric lens, you don't have to wear glasses for distance, you'll only have to wear glasses for near. And if you implant a toric multifocal lens, you don't have to wear glasses at all. So basically there are three types of lenses: a monofocal, a toric, and a multifocal. So if you implant a multifocal lens, you don't have to wear glasses at all. And that is my personal recommendation for all my patients. I think there is one more question in the chat box. The user has used his name. Um, his question is, how safe is robotic surgery, and how expensive is it? Is it more expensive than the conventional surgery? Yes. So that is a very good question. Robotic surgery is been into use for past 3 years. We were the first people to get this technology in Chennai. Now there are a lot of advantages which I saw with this technology. It made cataract surgery much more safer. So definitely safety is the main thing with this particular technology. See, initial earlier days, what we used to do is we used to manually cut cataract into pieces and remove it from the eye. But with the femtosecond laser or the bladeless cataract surgery or the robotic surgery, what the machine does is it actually cuts the cataract into small pieces, and we can safely remove it from the eye. So this has made sure that it is a much more safer procedure. Second thing, the visual recovery is faster because there is not much ultrasound energy which is used inside the eye, and there is not much damage to the eye structures. So the recovery is faster, and there is no swelling inside the eye. There is no wound inside the eye. So the healing is faster. That is the whole idea of doing robotic surgery. And hence, when the healing is faster, the visual recovery or the quality of vision is also much better in these patients. Yes, definitely, it's a much more expensive technology. So the patient definitely has to pay a little more, but paying a little more for the safety and faster recovery of eye, it should not be a big deal, according to me. So that is why I recommend robotic surgery for all my patients.
Yeah, excuse me, doctor. The one question asked by Tirupati Arvind:
Mm-hmm.
if my child blinks the eyes frequently, what could be the reason?
Mm-hmm. Okay. Now, this is one of the common things which I'm seeing more often during this COVID era. Now, most of our children are stuck to these gadgets, and they use a lot of these gadgets for even for online classes. So what happens is there is something called evaporative dry eye. When they use these gadgets, especially when they keep the screen brightness more, there is evaporation of tears from the eye. And this causes dryness even in children. So when there is dryness, there is irritation in the eye, and they frequently blink their eye like this. So first thing I recommend is, if you notice that in children, make sure you take them to an eye specialist and rule out dryness. If there is dryness inside the eye, we should reduce the usage of these gadgets. Second thing is, we can use some lubricating drops, and this will usually disappear within 15-20 days. Now there are children who, in spite of using this drop, sometimes this dryness or doesn't disappear. Then there might be some other neurological problem, generally known as tics. And if in spite of consulting an eye specialist, if he feels that there is no eye problem, then you should consult a neurologist for this frequent blinking problem. Though it is a very rare thing, if it is treated at early childhood, then this problem can go off once and for all.
Thank you so much, sir. Yeah,
Do we
nice
have
answer
time for
given by you.
any? Yeah. Do we have time for more questions?
Yeah, one more question is asked by Lai Bolti.
Mm-hmm.
I exercise for children
Mm-hmm.
doing online classes.
Okay. Okay. See, not just for children. Uh, the eye exercises which have to be done by all of us who are using these gadgets, because we also do a lot of meetings on the computer nowadays, webinars. You're not able to attend live meetings, so we have a lot of talks, or we attend a lot of meetings through webinar itself. So my recommendation for everybody is you should follow the 20-20-20 rule. Okay, so if you are going to use the gadget, make sure you use it for 20 minutes. Then you take a break for only for 20 seconds, not a very long break. Look at an object which is around 20 feet away, like a tube light or a fan or somebody's face who's just 20 feet away from you, and then get back to work. So now by doing this, actually you relax your eye strain reduces. And make sure you blink frequently whenever you're using these gadgets. So by blinking, what happens is the eyelid acts like a wiper of our car. So it makes sure that it forms a coating of tear film on your eyes, and this reduces the eye strain and reduces the dryness also in your eyes. So that was the answer for that question, to reduce eye strain, digital eye strain as we call it. Do we have any other questions? Yeah, I think there's one question about glaucoma by one Mr. Dilip. Okay, he wants to know that his mother had glaucoma, and what is the chance of him getting glaucoma? Okay, now one thing is, though glaucoma is a genetic disease, not everybody whose parents have glaucoma will get glaucoma. My only message through this talk was, if there is any family history of glaucoma, it is better that all the children get their eyes checked up at least annually. And once the doctor says there is no glaucoma, at least once, twice, or maybe once in 2 years or 3 years, you can get your eyes checked, and make sure that your intraocular pressure is normal, your optic disc is fine. And if there is any glaucomatous change which the doctor detects, then make sure you start applying the drops, which will make sure that your pressure inside the eye is under control, and the glaucoma will not progress or will not go into the advanced stage.
Yeah, the one question
Mm-hmm.
by any patient of Money Pharma.
Mm-hmm.
Doctor, please tell about Leapy Flow technology. How
Okay.
many times to do in a year?
Perfect. So this is a very good question. See, LipiFlow is generally recommended only for patients who have advanced dry eye. This is not a treatment for everybody, okay? Because this treatment also comes with a little bit of expenditure. So I don't recommend it for everybody. So the first line of treatment, as I told you for glaucoma, similarly for dry eyes, is lubricating drops. And prevention is always better than cure. So first thing is, you have to find the cause of the dry eye. If you're using excess of computers, make sure you reduce the usage of computers. And if you have disease like thyroid or arthritis, this also causes a lot of the dryness inside the eye. So make sure your thyroid or arthritis is under control, the treatment for it is done properly, which will automatically reduce the dryness in your eyes. And the usual recommendation is usage of drops, maybe 2 or 3 times a day. If that keeps your disease under control, then you need not go for any advanced treatment. But in spite of that, we see that 20% of our patients still have severe dryness in their eye. So we do something called mebubography, which detects the dry eyes. And once the dry eye is advanced, we use the lippy flow. So basically, we keep these two cups inside the eye, and these two cups have two effects on the eyelids. One is, it generates a very mild heat, which melts the tear glands which are present in the lids. If there is any blockage of the tear glands, it melts those glands. Okay, it basically improves the oily layer of your tear film. Second thing is, it also massages the lids, which makes sure that the production of tears becomes normal, and hence it treats the dry eye to a great extent. We see amazing results in patients who have advanced dry eyes. So that is the concept of lippy flow.
Yeah, Doctor Sir, one question asked by one patient of naming Trapti. Does
Mhm.
migraine have any effect on vision?
Okay. Now, migraine is actually a neurological problem. It has nothing to do with eye. But some patients have seen that patients who have glasses also have migraine. This is known as refractive migraine. This is very, very rare. But usually what happens in migraine is the usual causes of migraine are if we don't have relaxed mind, if we are always tensed, that's first thing. Second thing is if we don't take diet on time. Okay, that is very, very important. Few people, whenever they go in sunlight, they develop this migraine headache. So my recommendation to people who are allergic to sunlight is either you can use an umbrella whenever you go out in sunlight, or at least wear a cap so that you don't the sunlight doesn't fall on your head directly. And fourth thing is few people who take a lot of cheese or coffee also have migraine. So make sure that if these are all triggering factors, you try to avoid them. And migraine can be treated very, very simply by few medications. So if you have migraine, if your ophthalmologist says that you don't have an eye problem and he recommends you to consult a neurologist, please consult a neurologist who will recommend you some kind of tablets which taken for a short duration can actually cure your migraine. You can also do some relaxation exercises like yoga, which actually relaxes your mind, and that also reduces migraine to a great extent. Yes, Rahul. Is there any other questions? Rahul?
Rahul sir? Yeah, doctor, no more questions, sir.
No more questions?
Yeah, sir.
Okay. So I think we should wind up this public awareness program here. And before I end my talk, I would like to finish by saying, please take up eye donation as a social responsibility and make sure you donate your eyes after your loved ones leave the earth. Okay, make sure you donate your eyes. Thank you.
Thank you so much, sir. Thank you so much.
Thank you, Mr. Manigandan. Thank you, Mr. Rahul.
Yeah,